A very good afternoon, students. This short video is for an important short note from the region of the face, and this is the dangerous area of face. And this video will describe which part of the face is called as dangerous area and why. Okay, and this I will deal first in this the venous drainage of the face. So you just learn this venous drainage of the face, and at the end then I will describe what is the dangerous area of the face. See, this is the face seen from the lateral aspect. Say for example, this is the right lateral surface of the face, and the face there are plenty of the veins, and these veins they drain the face. Beside these the veins, they communicate with the deeper veins. Say for example, it communicates with the venous plexus, which is called as the pterygoid venous plexus, and the pterygoid venous plexus through emissary vein will communicate deep inside the cranial cavity, okay, which is the cavernous sinus, okay, cavernous sinus. So this is the venous drainage of the face. For example, from the scalp, anterior aspect of the scalp and the forehead, you are draining the veins which are draining. They are supraorbital and supratrochlear. This one is the supratrochlear, the medial one, the lateral one is the supraorbital vein. Now these two veins, okay, at the medial angle of the eyebrow, they will unite to form what is called as angular vein. So the angular vein is formed by the union of the supraorbital and supratrochlear vein. Now then, this will run along with the facial artery at a distance. The facial artery is tortuous, and after angular vein, okay, which will lie just lateral to that of the facial artery, is straight. The facial artery is wavy, which goes very close to the angle of the mouth, and there is a distance between the vein. This is the facial vein, and in this facial vein and facial artery, okay, you will see a gate. Okay, let me draw the facial artery from angular artery. This will be the facial vein, and these two will come close to each other when they will pass from the neck. So this is the facial artery and facial vein. Now this will be the nasal branch of the facial vein or tributaries. Nasal tributaries called as the nasal vein. Then this will be the superior labial, which will be draining the blood from the upper lip. This will be the inferior labial, okay, or the vein draining the blood from the superior lip, and that of the vein draining from the blood from the inferior lip, okay. This vein which will go upward to communicate with a plexus of vein which is situated on the lateral pterygoid muscle, which you will learn later, is called as the pterygoid venous plexus. Pterygoid venous plexus. This is the venous and this is plexus. So this is pterygoid venous plexus, which is the plexus of the vein located in the infratemporal fossa onto the pterygoid muscles. And this is formed from the deep facial vein. That means one of the tributaries of the veins, that is of the facial vein, is also the deep facial vein, and this will break up into the pterygoid venous plexus. Now the pterygoid venous plexus through the emissary vein, this is called as EV, or we'll just writing EV. It is the emissary vein, and these emissary veins are those veins which joins the extracranial with the intracranial veins, okay, and this goes through the various foramina. This emissary vein here, it will go through the foramina ovale or other spinosum, and then this will drain the blood into a sinus which is on the either side of the sphenoid bone at the base of the middle cranial fossa, and this is called as cavernous sinus. So this is a sinus of the venous blood, and it is called as the cavernous sinus. So this communication with that of the facial vein is very important, and this communication is through the deep facial vein pterygoid venous plexus, emissary veins, and then the cavernous sinus. But at the same time, you should also note that this is the superior ophthalmic vein. See this? This is the superior ophthalmic. And the superior ophthalmic vein communicate with the supraorbital, supratrochlear and the angular vein, and it also drains into the cavernous sinus through superior orbital fissure. Then there is an infraorbital vein, and this is also draining into the cavernous sinus. Thus the orbit drains its blood to the cavernous sinus through superior ophthalmic and the inferior ophthalmic vein. So this is another communication, okay, from the orbital cavity or the structure which are present within the orbit. Now, if you trace this facial vein, okay, you will go that means below the margin of the mandible, and there it will communicate with another vein. So see this vein. This is called as retromandibular vein, in which opens is the maxillary vein. This is superficial temporal, which drains the blood from the temple region. Then this is from the deeper part, that is the maxillary. Superficial temporal and maxillary both unite to form what is called as retromandibular vein. Now this retromandibular vein, as it approaches the posterior or the angle of the mandible, it divides into two divisions, an anterior division and this is the posterior division. The anterior division of this retromandibular vein will run anteroinferiorly and will join to the facial vein to form what is called as the common facial vein. This common facial vein will ultimately drain its blood into the internal jugular vein. It will drain its blood into the internal jugular. So remember that common facial vein drains the blood coming from face into the internal jugular vein. There is one more vein here which is lying just behind that of the or posterior to that of the auricle. Okay, this is auricle, external ear here. And this is called as the posterior auricular vein, posterior auricular, which joins with the posterior division of this retromandibular. Anterior division was joining to facial to form common facial, but here the posterior division of retromandibular vein will join to the posterior auricular to form what is called as the external jugular vein. And this external jugular vein will run in the neck to join with the subclavian vein. Okay, so ultimate the blood from the superficial part of the face and side of the temple. This drains into the common facial vein to the internal jugular vein, and from the external jugular vein to that of the subclavian vein. So this is the venous drainage of the face. Okay. Now if you see the peculiarities of these veins of the face, since they have to drain the blood towards the gravity, because heart is in the thorax and hence there are no valves. Okay, as we have learned, there are the valves in the limbs, okay, especially lower limbs, so that the blood flow is only in one direction. Here it is not the case. Since the veins are here which are valveless, the blood can flow in any direction depending on the position of the head. If you are lying down, sleeping, then it can go in any direction. If you are standing, naturally it will go towards the heart only. Okay, so these veins are valveless vein. Secondly, the venous drainage is also, okay, it is enhanced or it is helped because of the movement of the jaw, movement of the facial muscle, in which all these tributaries are there, and thus the venous drainage from the facial veins, retromandibular as well as the posterior, is quite efficient. Okay, efficient venous drainage is there. Let us come to the applied importance, the dangerous area of face, or it is called as danger area of face. Why this is called as danger area of face? Those veins which are draining to that of the pterygoid venous plexus. Okay, pterygoid venous plexus through the deep facial vein. Okay, they are in communication with the cavernous sinus. It means the facial vein through the deep facial vein and pterygoid venous plexus, emissary vein, it is in communication with the cavernous sinus. And this facial vein is draining to, that is, to the superior lip or superior labial branch by the side of the nose through the nasal branch by the I would say from the cheek. Also these veins they are draining and from the inferior labial veins. Okay, so whenever you are in that position that the reverse flow can take place, then the venous drainage by these upper veins here, which are close to the nose, close to the upper lip, onto the upper part, I would say the anterior part of the cheek, all this will go through the facial vein, into the blood will go then into the deep facial vein, to the pterygoid venous plexus, to emissary vein and to the cavernous sinus. And cavernous sinus you will learn later, it is a very narrow space or sinus is there, okay, venous sinus is there, where there are small cavities interanastomosis, and in the wall of this cavernous sinus there are many important nerves are there, and wherever the infection is there, and why infection most of the time, if there is a collection of the pus near the upper limb to that of the side of the nose. In this yellow stapled line I have shown you the dangerous area of the face, which involves, which includes whole of the upper lip by this I will say the tip of the nose, side of the nose, that means ala of the nose, and by the side of the cheek, okay, anterior aspect of the cheek, going right up to the root of the nose. This is the area which is draining to the deep facial vein. It is draining. In certain situation, it will go into the deep facial vein, and then the infection can reach to the cavernous sinus. This infection is common in the teenagers, where the pustules or the pimples are seen in this area, okay, and pimples contain the pus, means infection, bacteria, and this infection through the deep facial vein can travel right up to cavernous sinus, and infection in cavernous sinus may lead to the thrombosis of blood, because the venous flow in cavernous sinus is very slow, and if there is infection because of the small cavities through which it has to percolate the blood, there is a very slow, flow of the blood is there, and this will allow the blood to clot or become a thrombose, okay. When the blood become clotted, thrombose, this will interfere with the venous drainage, okay, and this will produce the pressure onto the surrounding nerves, okay. So this is dangerous, okay. This is dangerous because it is deep inside at the base of the brain, okay, into the middle cranial fossa. So this condition, the thrombosis of cavernous sinus, okay, is dangerous. That's why it is said that one should not press the pimples or pustules which contain the infection here, otherwise the bacteria may travel through the deep facial vein into the cavernous sinus, and that is the reason why it is said to be a dangerous area of the face, okay. Now question comes, why this will travel into anti-gravity direction. See this is the deep facial vein, pterygoid venous plexus, emissary vein, and the cavernous sinus is at the top. Okay, from upper lip to the cavernous sinus it is going. It is going in the anti-gravity direction. As I said in the beginning of this video, is that these veins are valveless, there is no wall. It can flow, the blood can flow in any direction. The venous blood can flow in any direction. And especially when we lie down or when we are sleeping, okay, the blood can flow in upward direction also towards anti-gravity is for standing position, not for that of the lying down position. As I said, the second factor which is more important is that all those movements which jaw is making and the muscles contraction, that will also lead to the flow of the blood into anti-gravity direction, leading to the cavernous sinus thrombosis. Thank you very much for watching this video.